Joining me now in the studio is one of the members of the Governor's Task Force on Mental Health, Representative Roz Peterson. Welcome.
Thank you.
When I was growing up, mental health had a really negative stigma. So has that improved? Is it easier to talk about mental health today?
Well, I do think it is a little bit easier because mental health has no discrimination. It affects all different income levels at every race and every age group. And so I think that you find that every one of us has been able to be touched positively or negatively in some fashion with mental health issues. And so I think that some of those barriers are being dismantled, although I won't say that they're completely gone. There certainly are still issues that we're dealing with.
From your perspective, do you think mental health challenges are on the rise, or is it possible that we as a society are just that much more aware of it now?
I think it's a combination of both. I agree that it does seem that there seems to be more problems with mental health issues. In fact, suicide is the leading cause of death more than car crashes. And when you see statistics like that, you can only be concerned that there are things that seem to be troubling people in a greater fashion than they were before. However, I do think that there is more diagnosis and more treatment available for people who are dealing with mental illness issues and mental health issues.
For those of us who observe mental health from the outside, it really seems to be putting a lot of pressure on our law enforcement. There's also notably a lack of beds for mental health, and so often those people are ending up in jails. The legislature has looked at this issue. Does more need to be done?
It was great to have the mental health task force. So we had people from law enforcement, people in the mental health system. We had basically all stakeholders at the table. And so it was nice to be able to talk about a lot of these issues in a very open fashion and being honest with each other of what was working and what wasn't. One of the things that came out of the bed issue was that there seems to be a log jam where people don't necessarily need the hospital bed, but there was no place for them to go afterwards. So I think what we need to look at is how we can help streamline that process so that we can get the right health care at the right time for the right people. And that is the challenge with what we're dealing with now. And I do think that there is an appetite in a bipartisan fashion that we need to look at additional resources from that standpoint. In the last legislative session, there were additional resources added to mental health issues, but there's always more that can be done, and there's always ways that we can start looking at taking our existing resources and how we can apply them more effectively as well.
Did you look specifically at addiction? Because issues of addiction factor in crime, homelessness. I read one statistic that 50% of homeless individuals experience mental health problems, violence, broken relationships. Can the issue of addiction be addressed at the legislative level?
Addressing is one thing, but there's definitely a recognition that a lot of these issues are interrelated. There are many people who have mental illness that also have chemical addiction problems, and some that do not. There are some that get hung up in the criminal justice system and others that do not. So we really have to look at things more of an individualized basis and not necessarily have cookie cutter type legislation that puts everybody in the same box. And communities also have different resources as well. And being able to recognize the different resources that are available across the state is also difficult to just put in a simple law by, for example.
Right.
But I do think that we can work together in a more collaborative fashion so that we can make sure that all of those resources are integrated and working effectively together.
There's reportedly a high turnover rate for mental health workers, and Minnesota already has a tight labor market, and that tightness is projected to increase. So at the legislative level, what can be done to address the issue of worker shortage and burnout and salaries for those people charged with caring for people in crisis?
Well, it's a great subject that you bring up, and Sue Aberholden, who's the executive director of NAMI, talked about we can't do much more because we have a workforce problem as well, and so we really have to look at those workforce pipelines and make sure that people are trained properly and compensated properly so that we can attract good people to work in these areas too. They're difficult jobs many times, and a lot of times they're physical, and so we have to make sure that we have policies in place that not only can attract a quality workforce, but create a safe working environment for the individuals that are working in these areas too.
The 21st Century Cures Act, which has provisions addressing mental health, just passed the U.S. Senate, and President Obama is expected to sign it into law. So that bill has very broad bipartisan support. Do you think there is similar bipartisan support for addressing mental health issues in the state of Minnesota?
Absolutely, and we've even seen that over the past several years too, that we have people on both sides of the aisle recognizing that if we can help work on some of these mental health issues, that it will have a trickle-down effect or trickle-up effect with families and how they're working together. We heard a lot of testimony of how our system is broken. It's a lot better than a lot of other places, but areas that we certainly can do better. And sometimes families didn't even feel like they could play a role in helping their loved one get the care that they needed. And so things like that, to dealing with people who don't have family members that they can lean on as well. So I think that there is strong bipartisan support to do things that will help Minnesotans in general, for sure.
If you could say just one thing that you learned from this task force that will stick with you, what would that be?
Well, I learned a lot about IRTs, which are housing for people who are more or less in transition from leaving the hospital to going back to their regular home. And I think that if we look at housing so that we can stop that logjam and work with communities so that we can find the right kind of housing fit that'll work for people, I think that that will help address that streamlined process that we can hope people move on. And I know in other states they have some other types of housing programs that maybe we could follow as well. I have a personal story. I have a sister who's been suffering, or excuse me, not suffering, but has been dealing with mental health issues for over 40 years. And so we've seen a huge transition of what it used to be way back then to what it is today. And we certainly have moved considerably forward over those decades. But I look at how we're going to work with her as she gets older and her family grows up and find out what might work best for her. So this is a personal issue for me as well as it is for a lot of other people that I know that deal with these issues. So I'm very hopeful.
Representative Peterson, I want to thank you so much for your time today.
Thank you.